A person's not made of just medical issues. There are many parts of the body and the head and emotions, and the psyche is a big, big part of who we are, but it's often neglected in our community. Whether or not you're homeless, whether or not you're low income, it's still stigmatized. These people need a place where they're cared for, where healthcare is more than just the medical. Our clinic's a one-stop shop. We provide basic medical care, chronic disease management, acute care. We have ultrasound on site. We have a dietitian on site as well, medication management for mental health issues, as well as counseling. Being a nonprofit is a big challenge, especially in Denton where there are tons and tons of nonprofits. PointBank has always been a very big supporter from day one. You have accounts that are made for nonprofits. It's there to meet our needs, and that's the way it should be. For us too here, the patient comes first. And PointBank is the same way. For our clay shoot, which has now become one of our big fundraisers, they always have one or two teams. And not only that, they've been the winners every time. We're challenging other community resources to outdo them. So it'll be interesting next year. I love their monthly breakfasts. There's time for each of us to talk about what's coming up or what's changed. And so all of a sudden I don't have to hear about, oh, this business has a new product, or this business expanded to do this, or this business moved. We know firsthand, and no other bank does that. They know what's going on in the community. They're a true community bank. When we talk about the homeless or the low income and their need to feel important and feel cared for, that's a human characteristic. Somebody knows you, somebody says hi, you feel good. And PointBank fosters that behavior.
Member FDIC, an equal housing lender.